Under the Senate bill, we will stop insurance companies from denying you coverage or charging you more because of pre-existing conditions. This will end the egregious industry practice of discriminating against survivors of domestic violence. Insurance companies will also no longer be able to charge women more for their health coverage just because they happen to be women. We'll ban lifetime caps and end unreasonable annual limits on your benefits. These insurance market reforms will help Americans, but they will be particularly life-changing for families like the Battersons, who live in Bloomington, Minnesota. Linda Batterson has 3 daughters. She owns her own business, and her husband, Bud, is a realtor. The Battersons have some relatively minor health problems, asthma, allergies, and back problems. But because health insurance companies can charge them more based on their health history, their only health care option in Minnesota is Minnesota's high-risk pool. This year, they're paying nearly $21,000 for health care. $21,000 for their insurance. And this is not a Cadillac plan. Neither the Battersons' businesses nor their family can sustain these costs. But the good news is that the Battersons will get relief under our bill. They'll be able to go to the exchange and find an affordable plan. Health insurance companies won't be able to charge the family more because of their health history. And if companies are going to raise rates, we'll have to publicly disclose and justify any increase. I think we can all agree that one group of Americans that really suffer under our current system are small businesses. Across Minnesota, from Bemidji to Spring Valley, I've talked to small business owners who want to do the right thing. They want their workers to be healthy, but they just can't afford the current unpredictable and skyrocketing rates. In Minnesota, we've got 92% of our state covered. And we've invested resources to create the Minnesota Care program to make sure low-income residents are covered. But even with all of this success, the uncontrolled cost of health insurance is forcing us to tighten our belts and make sacrifices that no American should have to make, like small businesses having to choose between laying off workers or dropping health insurance for everyone. I'm pleased to tell you today that this bill will bring real relief to small businesses across our country. We will even the playing field so small businesses can do the right thing for workers without sacrificing their bottom line. This will make them competitive with large employers and with companies from overseas, so they can attract the best and brightest workers. Right now, small businesses are often priced out of the markets. They may be lucky to find just 1 or 2 carriers willing to cover their workers. So the first important change that health reform can bring will be choice of plans for small businesses. They will be able to participate in the exchange, which will offer them a choice of reliable plans. This coverage will be less expensive and provide better coverage than what's available today. Now, right now, if you're a business with, say, 15 employees, and one of them gets sick or has a baby, your premiums are going to go up dramatically. That's because your risk pool is 15. But when you choose from policies on the exchange, your risk can be pooled with hundreds or even thousands of other businesses. That's the whole point of insurance, to spread the risk over the greatest number of people. The second key benefit for small businesses is tax credits to help business owners purchase coverage. Effective immediately, these credits will ease the burden on small business owners who offer coverage but are being squeezed in the current market. For business owners who haven't been able to offer insurance The tax credits will provide a new incentive to begin covering their workers, keeping the workforce healthy and productive. Today, I've touched on just a few elements of the health reform bill. I'll be back. I've touched on insurance market reforms and provisions tailored to the needs of small businesses. But this just scratches the surface. The public option will bring much-needed competition, and the incentives for high-quality care will make us all healthier. Taken together, these elements will bring our country into a new era in which high-quality and affordable health care is a reality in this country. Passing national health reform this year is my top priority because I've listened to Minnesotans across my state. They've told me loud and clear that the current health insurance system isn't working for them. And they've told me that they want access to care, and I have heard them. They want to know that they can start a small business without worrying about the cost of health insurance because one of their kids has a pre-existing condition. They want to know that they'll have health care when they need it the most. And they want insurance companies to prioritize health services over profits. And they are looking for us to fulfill our promise to pass comprehensive health reform this year. I look forward to working with all of you to make this a reality, and Madam President, I yield the floor.